Welcome everyone, I'm Neeraj Kumar Kaithal. In our today's video, we are discussing few important medical signs and symptoms that are really very important. Every health personnel must know about these medical signs and symptoms. Before starting, we will tell you about what is the difference between signs and symptoms. So guys, let's get started. Difference between symptoms and sign. A symptom is any subjective evidence of disease, while a sign is any objective evidence of disease. Means a symptom is a phenomena that is experienced by the individual affected by the disease, while a sign is a phenomena that can be detected by someone other than the individual affected by the disease. Let's clear it with the examples. Anxiety, pain, and fatigue are all symptoms. In contrast, a bloody nose is a sign of injured blood vessels in the nose that can be detected by a doctor, nurse, or any other health personnel. Let's start the topic medical sign and symptoms. First is hoarseness of voice. This condition is seen in carcinoma of larynx or laryngeal cancer or cancer of voice box. Constant irritation of the throat and feeling like you have to cough or clear your throat can be an early cancer symptom. Breathing problem, noisy type of breathing called stridor may occur if the opening between the vocal cords is narrowed by laryngeal cancer. Difficulty in swallowing also seen in this type of cancer. Next, cherry red face. This is seen in carbon monoxide poisoning. Carbon monoxide poisoning typically occurs from breathing in too much carbon monoxide. Symptoms are often described as flu-like and commonly include headache, dizziness, weakness, vomiting, chest pain, and confusion. Large exposures can result in loss of consciousness, arrhythmias, seizures, or death. Next is butterfly rashes on the face. Butterfly rashes are seen on the face in the condition known as systemic lupus erythematosus. Commonly it is known as SLE. SLE is an inflammatory disease caused when the immune system attacks its own tissues. Lupus can affect the joint, skin, kidney, blood cells, brain, heart, and lungs. Symptoms vary but can include fatigue, joint pain, rash, and fever. These can periodically get worse and then improve. Next, ascending paralysis. Ascending paralysis condition seen in Guillain-Barré syndrome. Guillain-Barré syndrome, a condition in which the immune system attacks the nerves. The condition may be triggered by an acute bacterial or viral infection. Symptoms starts as weakness and tingling in the feet and legs that spread to the upper body. Paralysis can occur. Special blood treatment can relieve symptoms. Physiotherapy is required. Next important medical sign and symptom from measles disease. Yes, Koplik spots. Koplik spots, little spots inside the mouth that are highly characteristic of early phase of measles. Measles is also known as rubeola. The spots look like a tiny grains of white sand, each surrounded by a red ring. They are found especially on the inside of the cheek, that is buccal mucosa, opposite the first and second upper molars, named for the New York pediatrician Henry Koplik, who discovered them. Next, frothy sputum. Frothy sputum is seen in pulmonary edema condition, a condition caused by excess fluid in the lungs. Pulmonary edema is usually caused by a heart condition. Other causes include pneumonia, exposure to certain toxins and drugs, and being at high elevations. Depending on the cause, pulmonary edema symptoms may appear suddenly or develop over time. Mild to extreme breathing difficulty can occur. Cough, chest pain, and fatigue are other symptoms. Treatment generally includes supplemental oxygen and medication. Next is spider angioma. Spider angioma is seen in liver cirrhosis. Cirrhosis is a condition in which the liver does not function properly due to long-term damage. This damage is characterized by the replacement of normal liver tissue by scar tissue. Cirrhosis is most commonly caused by alcohol, hepatitis B, hepatitis C, and non-alcoholic fatty liver diseases. Gross painless hematuria. This condition is seen in bladder cancer. Hematuria means the presence of blood in urine. Lockjaw, also called trismus. Lockjaw condition is seen in tetanus disease. Tetanus is a serious bacterial infection that causes painful muscle spasm and can lead to death. Next, pulsating abdominal mass. This condition is seen in abdominal aortic aneurysm, an enlargement of the aorta, the main blood vessel that delivers blood to the body at the level of abdomen. An abdominal aortic aneurysm can be life-threatening if it bursts. Abdominal aortic aneurysm are most common in older men and smokers. Abdominal aortic aneurysm often grows slowly without symptoms. As it grows, some people may notice a pulsating feeling near the navel. Pain in the back, stomach, or side may be sign of impending rupture. Stopping smoking may slow their growth. Small ones may only need monitoring. Aneurysms that are too large or growing too quickly should be repaired with surgery. Next, medical sign and symptoms. Cloudy vision. Cloudy vision is related with the cataract condition. A cataract is a clouding of lenses in the eye which leads to decrease in vision. Cataracts often develop slowly and can affect one or both eyes. Symptoms may include faded colors, blurry vision, hollows around light, trouble with bright lights, and trouble seeing at night. Next, rigid broad abdomen. This condition is seen in peritonitis. Peritonitis is an inflammation of the membrane lining the abdominal wall and covering the abdominal organs. Peritonitis is usually infectious and often life-threatening. It's caused by leakage or a hole in the intestine, such as from a burst appendix. Even if the fluid is sterile, inflammation can occur. Symptoms usually include pain, tenderness, rigid abdominal muscles, fever, nausea, and vomiting. Antibiotics are almost always required along with surgery and drainage. Next, descending paralysis. Descending paralysis is the condition seen in multiple sclerosis, a disease in which the immune system eats away at the protective covering of the nerves. In multiple sclerosis, resulting nerve damage disrupts communication between the brain and the body. Multiple sclerosis causes many different symptoms including vision loss, pain, fatigue, and impaired coordination. The symptom severity and duration can vary from person to person. Some people may be symptom-free for most of their lives, while others can have severe chronic symptoms that never go away. Physiotherapy and medication that suppress the immune system can help with symptoms and slow disease progression. Last, Medical sign and symptoms from emphysema disease. Barrel chest. Barrel chest condition is seen in emphysema, a group of lung diseases that block airflow and make it difficult to breathe. Emphysema and chronic bronchitis are the most common conditions that make up COPD. Symptoms include shortness of breath, wheezing or a chronic cough. Rescue inhalers and inhaled or oral steroids can help control symptoms and minimize further damage. Thanks for watching everyone. In our next video, which medical sign and symptoms you want to learn? Please tell us in our comment section below. And if you think this video is helpful, please like the video, share with your friends and help them to grow. And in the last, don't forget to subscribe our YouTube channel for nurses preparation.